Hi.
Oh, hello.
Hi.
Sorry, I'm about to
I
sit in
think
the kitchen.
congratulations are in order.
Thank you. Thank you so much.
Well done. Well done. You've really
Thank you.
worked hard, and
Thank you.
I'm so pleased for you. So tell me what about it. What was it? How did it
Um,
go?
I think it went well. It was a lovely experience. It was the anxiety was there, but what's helped is the fact that I've practiced and attended a few mocks, so that's
Yeah.
helped, and that puts my the anxiety to ease a lot immensely. So we started with a presentation.
Yeah.
In psychiatry, we start with a presentation, pre-prepared, and after which I was asked questions on concerning the presentation itself
Yeah.
about what do I think about a leader in front, leading in front and at the back,
Yeah.
and
Okay.
what kind of leader am I?
Wow.
And they asked about the CV question.
Mm-hmm.
And what do I have, apart from clinical skills, what else do I have to bring into this trust? What makes me different from others?
So you use the step.
Yes, I use the
Talk
camp.
me. Talk about the trust.
Yes, yes.
You were ready for
So
that.
yes, I was. There was conflict resolution question. That was the last one, and I was so glad because I think I had practiced that, and we did that on Tuesday. So
Yeah.
that was helpful. They asked me the insight question. A colleague told me that a patient made an allegation against a specialty doctor, my specialty doctor, that was inappropriate towards them. So
Hmm.
what would I do? So that was like the safeguarding question.
Yeah.
But I got a feedback regarding that in particular that I will follow the trust safeguarding process, that they don't expect me to do everything because I was saying, oh, I would invite the specialty doctor, talk to them, non-judgmental support, HR, time off, find out what's wrong. But he said what matters the most, because as a leader, I can't do everything.
Yeah.
I will start the trust safeguarding process, then inform the HR and protect the patient safety so that it's not compromised, and other patients as well. So yeah, I was told I did everything, but I could have just mentioned the start the trust, yeah,
And I
safeguarding
think that was
process.
the right way to do, because if you
Mm.
just go for the trust protocol, they will say, "Where's your thought process?" But
I
if
see,
they
I
give
see.
you the job and say, "Well, yeah, that was fine for interview, but in real life, just follow the trust
Oh
protocol."
yes, and I think that's what they really said. To be honest, that when I start, because they don't expect me to do be
Yeah,
running around that.
you can't do all of
Uh,
that. Yeah, yeah.
yeah.
So,
So
anything you found difficult?
yeah, I think it was
Just the nerves.
yeah, it was the nerves, but and then there was a diversity and inclusion question that I think they asked me, in what can I give an example of when I involve the patients in
Okay.
decision making.
Yeah.
So but luckily I was able to think of a lot of examples, and I just used the clinic the previous day where I was, that is very important, co-production, inclusion, and to allow for clinical effectiveness, we need to use evidence-based, guideline and all that, so that patient has informed choice. They can make informed choice. So making them aware, like for example, in ADHD, the clinic I did the previous
Yeah.
day,
Yeah.
I had to make them aware that we have stimulants, non-stimulants, things
So
like
you
that,
were
and
able
side
to put
effects.
together something on
Yeah,
the spot for a
on the
difficult
spot.
question, give
Mm,
them an answer, convincing
yeah.
answer to get the job.
Yes. So even the leader question, what do I think about a leader in front and behind? I was able to think about the one in front is strategic. The
Yeah,
one behind is a reflective leader. And I think
yeah,
they like the answer.
yeah, yeah.
So
And I think so. Tell me, what part of you've done the program with Career for Doctor? What was the
mm.
best part that you like? Oh, how did you feel you were supported?
Oh, I felt very well supported. I was offered even more chances of practicing doing a mock exam. At my last mock, and I find the master class very supportive, encouraging us to practice even when we didn't know what we were saying. And trying that increased my confidence in so many ways that I had it in there, and it made me think spontaneously. And
And you were quite proactive as well, and
mm,
it makes a difference, because sometimes people don't speak, oh my God, what if I'm wrong? So what? But
Mm,
that's your opportunity, and you used it quite correctly and to
mm,
your best advantage. So,
mm.
again, anything else you liked apart from the masterclass? How about the
The,
one to
res-
one?
the
The mo-
resources were great. The examples, the recorded videos, I found them
yeah,
very helpful, especially when I'm practicing and there's no one around. I will just play it, pause it, and try to
exactly.
give answers. And the one-to-one too, they were really lovely. I found it was individualized. It
All
was
right,
very
fine.
good. Thank you so much. Thank you.
Okay.
I think even now, like, was it today? I was thinking in my, I was just, within my head, trying to do something. And I was like, oh, I'm an expert in this. And I was like, oh, you don't need it anymore. I was already thinking, oh, let me add that with that. I'm an expert in this. I have gained this. And I said, oh, you don't need to. I think subconsciously, I'm still practicing, even though I don't need to. So,
You don't need any more.
no,
Your 10, 15, 20 years plan is done, and now you
it's
can get
done.
drunk, enjoy, open that bottle of champagne,
Yeah,
and
yeah.
all the time with the kids, not with Dr. Gag or Career for Doctor.
No,
No more
yeah.
seminar, but I'll miss you. We'll
I'll
miss
miss you
you
too.
because you were so
I
good.
miss you too. Even yesterday, I was like, oh, I'm missing something. But then I realized, oh, you don't need to join.
I don't need to go for a
Oh,
master class.
no. But thank you so much.
No,
Uh,
thank you and congratulations.
thank
Really,
you,
really,
thank
you
you,
worked
thank you,
hard, and
thank you.
it just shows that preparation makes a difference, and the
It
right
does. Thank you.
preparation makes it. Anything you
Thank
want to
you.
say? Who's preparing for consultant interview?
They can do it. Keep preparing. This is my first interview ever, and I got it.
First interview and you got the job.
And I got the job. And
Ooh,
the pre-interview visit is very important. I met with everybody, the CM, the clinical lead, clinical director, I went to the team, I went to the trust, I met with the clinical leads in the team. So it's very helpful. And thank you for the questions. I was asking, every time I met with everyone, the service manager, they were very
yeah.
helpful.
Yeah, it helps if you ask the right question because then you
Yes.
get the inside information. If you go
Mm,
for pre-interview visit, just like, yeah, I have to meet them, but then you're meeting them with a purpose in mind. And if you do
mm,
that, then you're successful as you are. So
mm.
well done, Abby. Thank you.
Thank
And thank
you.
you for
I,
speaking to me. Enjoy the
I
rest
need
of the
to.
evening.
Thank
Bye.
you. Bye.
Bye.